This is episode 43 of the BioBalance Healthcast, and I'm Dr. Kathy Maupin.
And I'm Brett Newcomb. And today we are continuing our conversation about some of the ancillary products and services that are available at Kathy's office. In the last podcast, we talked about all of the different skincare products that you researched and developed and made and
private labeled.
And private labeled because you are the medical director of the pharmaceutical or the cosmeceutical company that makes these products.
Yes.
But there are other things that you do or that you have available that we didn't get a chance to discuss. And so that's what we're going to talk about today. And we're going to start with talking about the different laser equipment that you have and the uses that you have for that and the people that you have doing it. So,
I think that lasers are very confusing to the public because I read all the women's magazines, of course, to see what they're talking about. I know you don't, darn. So I'll be more informed on this than you.
Good.
But I see what they're talking about, and they talk about a class of laser called fractional laser, but it has lots of different names. So in some articles it talks about Frax, F-R-A-X. That is a fractional laser, but it's a certain company. Okay, and I have a pixel laser which does exactly the same thing, but it's called a pixel because it's a different company. The company that I have my laser through is Alma Laser, and they've renamed all of the different lasers that I have. So, having said that, you have to sort this out and see what kind of a laser actually it is to tell what you need. Generally what happens in my office is somebody makes an appointment, they come in and we do an evaluation of their skin and what their desires are, just like you would in a plastic surgeon's office. What bugs you, because what bugs you is what you want fixed, not what bugs me.
Yeah, so if I have a blemish, if I have a scar, if I have a brown spot, a liver spot, wrinkles, really?
Wrinkles, or if you think your pores are too large, or there are different things that bother people, but wrinkles are what Pixel does the best at. And Pixel is a...
What if my eyebrows are chronically arched in surprise? Can you fix that?
Yeah, Botox.
That's something. You don't do that there.
Yeah, we do.
Do you?
Yeah, we do.
Okay, I didn't know that.
We now have Abby, and she does Botox.
Okay.
So she's a nurse practitioner. She's awesome. So in any case, back to the lasers, the fractional laser is fractional because it goes through your skin and it hones in on the collagen that is below the surface of your skin. And it does little dots or pixels, little tiny dots into the collagen that then stimulates the activity of growth. So you get tighter and thicker collagen by these tiny little dots of laser going down into the collagen. You think, well, why don't we just laser the whole thing?
Yeah.
And well, that means that you get burned badly. And so that's what CO2 lasers do, is they burn you all over. I don't have one of those. They burn the face so badly that it tightens and it sometimes loses the melanin. By doing this, we tighten the skin without a burn and without losing melanin. So it's ideal for doing a scalpel-less facelift. And some of us have that done every year.
Yeah.
Because that's what you have to do. You go out in the sun, you have more life that you live, and more frowning and more stress, and then you make wrinkles, and then you have to go back and have it all cleaned up, and that's how we do that. And it's called a pixel or fractional laser. What?
No, I'm just translating that into my own knowledge base. You know what a frontal lobotomy is. I don't know if you ever saw the Francis Farmer movie, but where they used to just sever the frontal lobe.
Right.
And now, for a lot of things, they don't do that. They go in with a laser and they burn specific spots in the brain.
For good reason.
Exactly. But what you're saying, if I'm understanding it, is that the increased level of precision allows you a whole lot of flexibility in what you do, and then allows you to have more of a range of effect so that you can control it.
And the other part that people are always interested in is downtime, because downtime is something they don't have. Women are busy and they don't want to have to stay home. With the CO2 lasers and the other lasers that completely ablated or burn the skin.
Like sandblasting your face.
No, it's much worse than sandblasting. It's like putting your face on a frying pan, basically. But
searing it.
Yeah. But if that would work if you had terrible acne scars or something like that just didn't work for. But our downtime is 3 to 5 days, and that's that's really good. It does hurt, and we give, because I'm a physician, we have the advantage of being able to give pain medicine before and after, and I give medication for the skin itself, and then some of my products, so that somebody can heal much faster and get back out into the world. We also recommend that 3 days after their pixel, they come in for a jet peel, another procedure we have, which is using water to take the top layer of skin off. Because what's happened when you do a pixel is the top layer of skin starts dying faster just because it's been damaged a little bit, so it comes to the surface, and if you can get it off, you can see the final results faster, and you can get the redness and that kind of thing gone. And you also hydrate the skin, because the jet laser. Peel, the jet peel is not a laser, it's just a very high pressure water jet. It actually injects hyaluronic acid, if you like, or collagen into the skin. Hyaluronic acid is one of the things collagen's made out of, and I suggest that after pixel, because that's what the pixel's affecting. It needs food, and so the food is the hyaluronic acid. It gets food from your body, from albumin and from the protein in your blood, but it needs food as well placed into your skin locally. So that's one of the things that I suggest at 3 days, so people get back to work at 4 and 5 days.
So what does that do then? Does it grow a new layer of skin, or does it feed and make healthy the layer of skin that's already growing? I mean,
what most people don't know is that skin grows from the base, from the dermis, and it grows up, and as it gets to the top, the cells die. Right. And that's a layer of dead skin that covers up your face and usually makes you look dull and makes your wrinkles look deeper. So what happens is this accelerates that growth. So in 3 days, you have a thick epidermis, not dermis, epidermis. And so we take off the dead skin with the jet peel.
So how often would somebody do something like that?
Which, the jet peel or the pixel? The pixel you should do until you get the results you want. And we know what the results are within 6 weeks, we can tell. Usually 3 months, it's final. So you could wait 3 months, and if you don't have the facelift that you wanted, then you can do it again. I've usually only needed to do one because I use my products, and I use excellent skincare and kind of routines that I do every day, and that makes a huge difference. Taking off the dead skin every day, exfoliating it, is always very important, because then the glow of your skin shows through. So
if I'm understanding right, you're talking about more of a global approach to skin care in your overall face. What if you have like just a brown spot or a discoloration, a port wine stain? I mean, can you work with those kinds of issues? Yes,
we have one of the lasers that we have is called something different by my company, but in vernacular that everyone understands, it's an intermittent pulse laser, and it's IPL. IPL is something that takes off all the brown spots. And when I was 40, before I ever had any of this myself, I had a series of IPL treatments to get the brown spots off. And the brown spots are very deep, and you can't always see them all. But when you have this done, all of the brown spots lift, and they come up to the surface and peel off. And that usually is a process of about 3 days, maybe 5 days in some people. But the first treatment's the worst, because it gets all that stuff that I got when I was sun tanning with baby oil and iodine when I was, a kid at the pool, or a young woman. So all of that damage comes to the surface. That's all precancerous damage.
Yeah.
And there are now recommendations by the medical community that for some of these really deep damages that are discolored, they're called actinic keratoses, we can actually use the pixel and the IPL to actually kill those cells and have them come to the surface and peel off.
So as a preventive measure, long before they'd ever become cancerous.
Right.
Because people, not as often, but people do die from skin cancer.
Right, they do. They do, and that's something we always have to worry about. But if you have all of the brown spots removed, then your risk of having skin cancer from squamous cell cancer is a lot lower.
So there are cosmetic reasons for doing this, to feel good or better about yourself and the way that you present. gives you more energy and more freedom to pursue what you want to do. But there also are medical reasons for doing these treatments.
And for most of my patients, those are secondary, just because they don't think they'll ever get skin cancer.
Right.
And so, but when they see the brown spots come up, they realize how much damage they've done. I usually suggest that a patient get one of these treatments every 6 weeks. Usually the series is 4. And then I also have them do their hands, because if you're in public and it's not summer,
right.
Your hands and your face are the 2 things that people see. And then if you have brown spots, if you have brown spots on your hands or on your face, you look older.
Yeah.
So why look older if you feel younger? Most of my patients with pellets feel a lot younger, so
Absolutely.
They should look younger.
Yeah.
Now,
what
yes.
about hair? You haven't mentioned that.
Sometimes
people come for laser treatments for hair removal.
Yeah, we have an excellent hair removal. It's the next generation. It doesn't hurt like most of them do. In fact, people are surprised they don't think we did anything when we're removing the hair. But we remove hair from anywhere you want hair removed from. The only caveat is you have to have your hair darker than your skin. So if you're graying and you want hair to actually be gone, then you should do this before you're graying in that area. In other words,
think ahead.
Think ahead. If you're starting to get gray hair and then your arm hair is still dark, we can get rid of the arm hair.
Right.
If you want to.
Yeah.
And a lot of men come in and we do their chest. Now, we're not going for the naked chest deal, but we're going for no caveman look. You know, the caveman look, as we get older, men get a lot more hair on their backs and on their fronts.
It falls off your head, down onto your shoulders, and on your back.
That's what it appears to do, doesn't it?
Yeah, I can attest to the fact that it does. And my chest fell too.
Oh, it did?
Yeah,
just like
gravity.
us. That may be because you lost so much weight.
Yeah, maybe. Maybe.
So in any case, this is one of the ways that we keep our patients looking as good as they look, or they feel, excuse me. And they do look better. We have better blood flow to our face after we have our hormones back. So in general, people look better without any of this, but then they see those wrinkles and they see that brown spot and they think, oh, I need to get everything cleaned up. So that's what we do. I offer this because I use it.
Would it be fair to say that your office specializes in making people feel better inside and look better outside?
That's
so
right.
that the whole package is a more enjoyable experience of life.
Absolutely. Absolutely. That's what
I'm always
I want my
reminded of that.
patients.
Remember the movie Trading Places with Eddie Murphy?
Yeah.
At the end, they're just like, looking good, Lewis, feeling good.
Yeah. Yeah.
And that's kind of what your goal is.
And people come in to show us how good they look. And now, instead of wearing their sweats to my office because they're so embarrassed of how they looked, they're now all dolled up. They've got their hair done. They've got their makeup on. They're ecstatic. That's one of the things that we go for. And I like to look at the before and after pictures, even if we haven't done any of the lasers. But I like to look at those just because I show them to the patient and say, this is what you used to look like just 4 months ago, and this is what you look like now.
Do you have releases so that you can post some of those before and afters on the website? So people that are curious can go and look and see the kind of things.
We haven't done that yet, but we have releases for that.
But you have plans to do that?
Yes.
All right, so that'll be coming in the future. If you have questions or comments about this podcast, you can email us at podcast@biobalancehealth.com. You can also read my blog at brettnewcomb.com.
If you have any questions of BioBalance Health or bioidentical hormones, visit our website, biobalancehealth.com, or call 314-993-0963.